Today, our group is going to present a drug that is being used by one of our teammates' grandmother who is 78 years old this year with multiple chronic diseases such as diabetes, hypertension, and high cholesterol and kidney failure. In our presentation today, we are mainly focusing on a drug called Amlodipine, which is a hypertensive drug that is widely used to treat high blood pressure and certain types of chest pain like angina. Now, what is Amlodipine? Amlodipine is actually a long-acting dihydropyridine L-type calcium channel blocker that is widely used in both adults and children around the world, in which it works by selectively inhibits calcium ion influx in vascular smooth muscle and cardiac muscle, thereby inhibiting these contractile processes of this tissue. It can result in peripheral arterial vasodilation and reduction in peripheral vascular resistance, and eventually can reduce the arterial blood pressure. For the exact full drug mechanism, my friend Viken will be presenting later. Now, you may be wondering why it is necessary for this patient to take this medication. First, as mentioned by me just now, that she has hypertension, and amlodipine is one of the most effective medications to lower blood pressure. And it works by relaxing and widening the blood vessels and allows blood to flow more easily to reduce blood pressure. Without this medication, her blood pressure may be even higher and dangerous for her situation, and because it can actually cause stroke to this patient. And secondly, controlling blood pressure is extremely important for her because she's 78 years old this year, and for older adults, they tend to have stiffer arteries which cannot expand properly, and even a small amount of pressure can cause blood pressure to rise sharply. And eventually, this makes the blood pressure much harder to control and more unstable. That's why antihypertensive drug like amlodipine is important for her, because it helps to relax the stiff blood vessels and lower the blood pressure. And she also has diabetes, as mentioned just now, and high cholesterol. These two conditions can further increase the risk of getting heart attack because of the fatty plaques that are already forming inside the arteries. So if the high blood pressure is not controlled, the high blood pressure will push against these plaques, and in which it increases the chance that the plaque will break and block the blood vessels and eventually lead to heart attack and stroke. And therefore, amlodipine is used to help to reduce this risk by lowering the blood pressure. And finally, the patient, as mentioned just now, she also has kidney failure, and uncontrolled high blood pressure can actually accelerate this loss of kidney function. And therefore, amlodipine is suitable for this patient because the drug is mainly being metabolized in liver, not the kidney. And this means that the drug can be used safely in the kidney failure patient without changing the dose.
My name is Viken, and now I will be explaining on the drug mechanisms of amlodipine. On a molecular level, amlodipine is classified as a hydropyridine calcium channel blocker (CCB). It exerts its effect by selectively binding to and inhibiting the L-type voltage-gated calcium ion channels on a vascular smooth muscle cell. Antagonizing calcium ion influx prevents the calcium interaction necessary for muscle contraction, as calcium ion is there to facilitate muscle contraction. This action promotes vasodilation, which lowers the peripheral vascular resistance, hence the primary mechanism for its hypertensive effect. In the context of angina, the vasodilation also improves coronary blood flow while reducing the cardiac afterload, therefore reducing the myocardial oxygen demand. Regarding its electrophysiological impact, amlodipine exhibits high vascular selectivity, meaning it has negligible direct action on cardiac conduction nodes. Consequently, it does not typically depress sinoatrial or atrioventricular nodal function, therefore it poses a minimal risk of bradycardia and heart block. Any observed increase in heart rate is usually a transient reflex response to vasodilation. A critical point of contrast is with verapamil, a non-dihydropyridine calcium channel blocker. Unlike amlodipine, verapamil directly inhibits calcium channels in both vascular and cardiac tissues, leading to a significant suppression of SA and AV nodal activity. This can result in clinically relevant bradycardia and delayed conduction. The combination of amlodipine and verapamil is considered potentially hazardous due to the risk of synergistic vasodilation that can cause severe hypotension. Therefore, these agents are rarely co-prescribed, and if necessarily, they must be administered with rigorous monitoring due to the elevated risk of adverse cardiovascular events. Moving on, let's take a look at the pharmacokinetics of amlodipine. Amlodipine is well absorbed from the gastrointestinal tract following oral administration. Its bioavailability is high, ranging from 64 to 90%, and it's not significantly affected by the presence of food. Peak plasma concentration are typically reached slowly, between 6 to 12 hours after ingestion. In terms of distribution, the drug is highly protein-bound in the plasma, approximately 93 to 98%. It has a large volume of distribution, indicating extensive tissue distribution, particularly to the vascular smooth muscle, where its main therapeutic effects are exerted. Continuing with the metabolism of amlodipine, Amlodipine undergoes extensive metabolism in the liver. It is primarily converted into inactive metabolites via oxidative dehydrogenation. The metabolism involves the cytochrome P450 enzymes, mainly the CYP3A4 isoform. Amlodipine is oxidatively dehydrogenated into pyridine derivatives and other smaller metabolites that are inactive. The extensive metabolism in the liver means patients with severe hepatic impairment requires dose adjustments on amlodipine. Finally, the elimination of amlodipine is typically long, between 30 to 50 hours. This leads to stable plasma concentration and consistent therapeutic effect throughout the 24 hours. Excretion of the inactive metabolites primarily occurs via urine. Some of the metabolites are excreted in the feces. Due to a high degree of hepatic metabolism, renal impairment does not significantly alter the drug's overall clearance. Therefore, dose adjustments is generally not necessary in patients with kidney failure.
Hi, here comes the side effects of amlodipine. Side effects of amlodipine can be separated by common side effects and less common side effects. Firstly, the common side effects after taking amlodipine is headache, dizziness, fatigue, and the most typical is peripheral edema. Then are the less common side effects: angina, tachycardia, arrhythmia, and shortness of breath. These are more harmful to our body, although it's less common. So if these side effects occur, please go to doctor as soon as possible. Let's talk about the precaution of amlodipine. You need to let your healthcare professionals such as your doctor or pharmacy know that if you have heart and liver disease, especially heart failure and severe aortic stenosis. You also need to share all the drugs and supplements that you are currently having to avoid conflict with amlodipine. Then you need to avoid alcohol intake. And also, you need to stand up slowly to reduce the risk of lightheadedness because amlodipine may cause dizziness. Lastly, you need to inform your doctor or pharmacist if you are planning pregnancy or currently pregnant and breastfeeding to avoid risks. Let's talk about the alternative of amlodipine. First, other calcium channel blockers like nifedipine and verapamil work similar with amlodipine, but might have different side effects and feeling. Second, ACE inhibitor like risinofil and enalapril is often used for edema patients. Third, ARBs, also called angiotensin II receptor blockers like losartan, valsartan, is suitable for patients that can't tolerate ACE blockers. Fourth, beta blockers like carvedilol, metoprolol is often used for patients with arrhythmia or angina. Last, diuretics like hydrochlorothiazide and indapamide can reduce fluid retention and help to lower the blood pressure.
Now I'm going to talk about some fun and interesting facts about our drug. Amlodipine is well known for its once-a-day convenience because it has a long half-life and the effect can be kept throughout the day. It also has a slow onset of action. It means that it lowers blood pressure gradually instead of causing a sudden drop. This slow and steady effect can help to prevent dizziness and make it a very comfortable medication for patients to take regularly. So, unlike some other antihypertensive drugs, amlodipine does not slow the heart rate. Instead, it works mainly by relaxing and widening the blood vessels. It is also very stable in the body. So, even if a patient misses a dose, their blood pressure usually does not rebound immediately. Beyond its role in hypertension, amlodipine can also help people with Raynaud's phenomenon by improving blood flow to the fingers and toes, reducing episodes of coolness and discomfort. That's all from me. By doing this presentation, we have understood the role of amlodipine in treating high blood pressure. We learned how it works in the body, the main benefits, possible side effects, and how it is suitable for patients with conditions like kidney failure. Its long-lasting and stable effects explain why amlodipine is commonly used in clinical practice. Thanks for watching.